Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is what you need to know about occipital nerve blocks. What exactly is an occipital nerve block? It's an injection of numbing medicine placed next to the occipital nerves, and there may be some steroid included as well. The occipital nerves are located on either side of the scalp. There is a greater and a lesser occipital nerve, and either one can be the source of pain. Neither of these has a motor function. They're only sensory and they only provide sensation to the back area of the scalp. The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches or cluster headaches, or migraines. The injections serve both a diagnostic and a therapeutic purpose. The symptoms of occipital neuralgia: individuals have pain in one or both sides of the head. They often have a tender scalp on either side, and the pain may be described as either aching, burning, throbbing, or it might be a sharp or an electrical shock sensation in the back part of the neck and head. So who benefits from an occipital nerve block? Well, as mentioned, those who have occipital neuralgia, those with migraines often benefit. A cervicogenic headache is really any headache caused from the neck. It's often one-sided. And then cluster headaches, which are one of the most painful headache types. The procedure itself is very quick. It just takes a few minutes. It can be done in the office as an outpatient setting. There's no need for sedation. You don't need to use fluoroscopy or image guidance. Basically, what the pain doctor will do is feel at the base of the scalp for the point of maximal tenderness, and that is the area that gets injected with the numbing medicine, maybe some steroid. And typically what pain doctors will do is move the needle around to try and encompass, as you can see, both the greater occipital nerve and the lesser occipital. They'll try and put medicine encompassing this area. Okay. Well, how well does the procedure work? For such a quick, low-risk procedure, it works amazingly well. Typically, patients will start to feel pain relief within minutes as the lidocaine or whatever type of numbing medicine starts to take effect. For cervicogenic headaches, studies show a 50 to 90% response rate, which can average 2.5 months, and then it can be repeated. Cluster headaches show a much higher response rate, 85%, and the response can range from 4 weeks to 4 months pain relief. Occipital neuralgia also has an 85% response rate, which can last for 1 to 2 months. And then migraines have a little bit lower of a 60% response rate, which can average 4 to 5 weeks. If these procedures work for a patient and then wear off, there is no reason the procedure couldn't simply be repeated on a regular basis. When the pain relief wears off, what's next? Well, as mentioned, you can repeat the procedure. It can work very well, or the individual can go on to have a radio frequency ablation procedure of the occipital nerves. Now that can be either pulsed, where it involves thermal energy on, thermal energy off, on, off, or it can be a continuous radio frequency ablation for about 90 seconds, which can deaden the occipital nerves. Eventually they'll grow back, but it can provide pain relief anywhere from 6 to 18 months. There are no large studies looking at radio frequency ablation, but there are some small studies that show that it works very well. Remember, we're talking about a very low risk procedure here. So what are the risks? Well, they're absolutely minimal. There may be some slight bleeding, you might get an infection or an allergic reaction, but the needle's outside the spinal canal. I mean, it's up here in the scalp area. It's not down here where the spinal cord is. It doesn't go through into the epidural space. So there's no risk of a CSF leak or spinal cord injury. It's a very low risk proposition. The top pain management clinics in the greater Las Vegas area are Nevada Pain. They offer comprehensive pain management with board-certified pain doctors doing both medical and interventional pain management. Over 50 insurances are accepted. The doctors have won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 702-323-0553. And visit us on the web at painmanagementlasvegas.com. There's a complete online library of information, just a lot to look through, very good information, and call today. This is Dr. David Greene with the Nevada Pain Network. Your pain stops here.